Hello, everyone. So I'm Bill Doherty. I'm on the faculty of the Department of Family Social Science at the University of Minnesota. I used to direct the Marriage and Family Therapy program and involved in a lot of community engagement projects and clinical training projects. This topic today is a new one for me. I like to not just present on the same old things, but I've been doing this one for about a year. Calling it CSI Therapy, Couple Sensitive Individual Therapy, a little playful there on the CSI television show. And it's basically, after a number of years, hearing from couples and also individuals about some ways in which their individual therapists sometimes didn't help and sometimes did help them in their primary couple relationship, and kind of being a critic of some practices that I don't think are that helpful. I decided to move from being a critic, finger-wagging type, to actually to develop a little training, and I'll be doing some writing on this issue of how, when you're seeing an individual adult in counseling or therapy who is in a partnered relationship, is in a couple relationship, that a serious one, marriage, long-term committed relationship, and that this is part of what they are bringing concerns about this relationship as part of what happens in therapy. How do you do a job that's sensitive to the fact that they're in that relationship and sensitive to the relationship? So that's what we're going to talk about. And I want to say that I think it's an issue that nobody I've talked to has ever said they had any education in how to do this. And so I think it's a kind of a blind spot in our work. In fact, we know that relationship problems or issues is right at the top of what people bring with them in individual therapy. And like it or not, we are kind of consultants as therapists to people's relationships. And so this little webinar is about how to do that in a conscious way, in a way that's sensitive to that relationship, to the partner, and does not make some serious mistakes. So here we go. So the context. A spouse or partner is like the third party in the room when we treat individuals, especially when they have complaints about the relationship. So they're there. In fact, if you're like me, I'm seeing an individual, I have an image of what that person is like, what they look like, what the tone of voice is. It's kind of like listening to somebody on the radio. You know, you have an image of what they look like. Therapy training, as I said, has not paid much attention to the subtleties of how we talk about the client's relationship partner. So we make it up as we go, sometimes with unfortunate results. So here's a definition of CSI therapy. It's individual psychotherapy that is mindful of the potential impact of the therapeutic conversations and interventions on the client's intimate partner and on the couple relationship. So it's mindful of the potential impact of what we say and what we do on the partner and on the couple relationship. Now, I want to say this does not refer to doing couples therapy with an individual, although many of the principles and strategies apply. So I'm not talking about a situation where you see yourself doing, you wish you were doing couples therapy, but you just have one person and your primary focus is on changing the relationship. As I said, a lot of this will apply, but the sweet spot for me is when somebody's coming in for the whole range of problems that people come to individual counseling and therapy for: depression, anxiety, all kinds of work-related stresses, and they have stress in their primary couple relationship. So that's what I'm talking about. So the challenges: how to create a therapeutic alliance without being drawn into the client's inevitably one-sided reality about a relationship. And when I say inevitably, that's true for all of us. I'm not just saying this is because these are people in counseling. So our chief challenge for the effectiveness of individual therapy is a therapeutic alliance. All the research indicates that. Without that, nothing else works. So they're complaining about their partner, and they're stressed. Relationship may be a form of hurt and pain for them, and so clearly I want to form a therapeutic alliance with them around that pain, but how to not just buy their reality about the relationship. How to avoid becoming an emotional lawyer whose job is to advocate for one side in a relationship conflict. Now, safety situations aside, if there is danger, of course, we have to become an advocate. But for most situations, it's very tempting to become the emotional advocate for the spouse and we're not hearing the other side. How to avoid turning the spouse or partner into a cardboard character because we don't know them. So we're getting to know our client with nuance and subtlety, and we're hearing often mostly negative things about their partner, and it's easy to create an image or a stereotype of them, what I call a cardboard character. What to do with negative feelings we experience when clients describe negative things their spouse or partner has done or said. So we're thinking inside, I can't believe he or she said that. What an awful thing to say. And what do we do with those feelings? Because we're going to have them. We're going to have them. And it's especially hard when you think the partner is a major source of the client's problems. So they come to me for anxiety, and I sure get how their anxiety is stirred up and whipped up in their primary relationship. And it can be easy to go from that to thinking, well, if they got out of that relationship, this would certainly help them and would certainly help my work with them. So all of that's especially hard in that situation. So I hope you're with me on the challenges. I'm going to go back up to that. And so just as we look at that list, hopefully you'll agree with me that these are major challenges when we're hearing a narrative of distress, and if we're hearing a narrative of complaint, we're getting quotes, we're getting, this is what this person did, this is what this person said, that is distressing and painful, harmful to my client. It's really hard not to be drawn in a way that is not constructive for the client or their relationship. And if you think about this, it's really a shame we don't get more help. We get help in terms of our countertransference, if you will, towards the client, the feelings we're having towards them, but we don't get, I don't think we get much help in terms of, if you will, our countertransference, our emotional reactivity to their spouse or partner. Next one down. Signs that the therapy is not couple sensitive. So first, letting the client engage in psychological assessment of their partner. This happens a lot, and unfortunately therapists often let it go. They let it go by. So you have a client saying, so my spouse, my partner, really has pretty low self-esteem. She came from a family that was on the kind of abusive side emotionally. and my partner never developed a kind of a core of positive self-image. Okay, so ask yourself, do you have a problem with that? I mean, it's said with compassion, right? I mean, because the way I just said it out loud wasn't dismissive. From what you've heard about what the client's partner does or says, maybe you agree. And what I'm suggesting is that if you don't challenge your client about talking like their partner's therapist, then you're encouraging them to have a kind of artificial distance, to be one-up, to be patronizing, to be paternalistic, to be, if you will, pseudo-caring about the wounds and vulnerabilities of their partner. And I think that's not couple-sensitive therapy. So in the Q&A, if you want to ask about that or challenge that, I'm certainly welcome to it. And I think that the trap particularly is if you agree with them, if you agree with them, that you think this is highly likely. What I'm saying is it's inappropriate, it's unhealthy for the client to be doing this kind of assessment, using our kind of jargon, if you will, with their partner. Next, regularly commenting on the spouse's personality limitations would be another sign. So your husband doesn't seem to be an emotionally available person. That's not necessary to say. It's a generalization about the personality of somebody we haven't met. The client at first may just love you for it, like, boy, you're really understanding me, and by the way, this is not my fault, because I've got this very limited spouse or partner. Next, offering a diagnosis for the spouse without having done an assessment, which requires you meet them. And this happens a fair amount. So I've had clients tell me that prior therapist had Xeroxed a page from the DSM saying, oh, take a look at this and see if you think this doesn't fit your spouse. And of course, the diagnoses are usually in the personality disorder category. Your self-centered spouse maybe fit the diagnostic category for narcissistic personality disorder. So, and it's not like therapists are like, okay, here is what your spouse is, but what I'm saying is offering a diagnostic label is rarely helpful. Rarely helpful. In fact, I would say the label is never helpful unless you were suggesting that somebody's spouse may be severely depressed, and you're urging your client to help them, see somebody, and you could say, I'm just concerned that they might be depressed or something. So I'm not saying never, but the kind of diagnoses that I'm talking about that individual therapists offer are often have an edge to them that is essentially colluding with the put down of the spouse. The next one, consistently attributing negative motives to the spouse. So why do you think she wants to control you? Is an attribution that of an intent, a motive, to somebody we've not met, to somebody who we're hearing negative things about, and I don't think that is useful. I think it's generally damaging. And as I'm going to talk about later, you can deal with all of these things in terms of the behavior. You can say, so you're feeling controlled by her. You could ask, what do you think is going on her side of this or his side of this, right? So in other words, you can deal with this experience that your client has of being controlled, and in fact, you may believe that's actually going on, that there's a really unhealthy control dynamic. So you can deal with all this stuff. I'm not suggesting just kind of acting as if every spouse or partner is a saint, but to attributed negative motives, why do you think she wants to control you, is quite destructive. It can be quite destructive of that relationship. You know, there's lots of research from attribution theory out of social psychology that has found that attributing malicious motives to one's partner is one of the most damaging things for a relationship. Next one, expressing pessimism that the spouse can change without knowing that person. And I've heard therapists say this. You know, people don't change their way of relating at this age. I remember a woman who came to see me. Her husband, in his mid-60s, had been diagnosed with Parkinson's disease, and he had become a pretty nasty guy. Consistently negative, mean-spirited, hard to live with. She had gone to a counselor. Now, this is what she said. I'm not attacking HMOs, but this was some years ago. And so she said, I went to an HMO counselor who, you know, very short-term work is what they told me they do. And in the first session, the counselor, she said, told her, well, you can either live with him or leave him. But he's this age, he's not going to change. And she was appalled. She was appalled at this, at what he said, that the hopelessness, and also she was appalled that he would suggest that she leave her husband of 40 years with him being sick like this. Now, as I talked with her and engaged her husband, this guy probably was having Parkinson's dementia. But even there, he was able to change. He needed her. He wanted to be with her. He loved her, and she got through to him that he couldn't treat her like a doormat this way, and he did change. So anyway, that pessimism, that sort of pseudo sophistication that would come out of a therapist, that they're not going to change. Rarely challenging the client's perspective about his or her contributions to the relationship problems, or focusing these challenges mainly on why the client puts up with such a difficult spouse. So if over time you're accepting the client's perspective fully about the other person being the problem, I mean, that's sort of, you know, garden variety is I'm unhappy and it's my partner's fault. And if we don't challenge their perspective, and if we never challenge about their own contributions to the relationship problems, then we're falling right into that. Or sometimes the only challenge is, I don't know why you put up with that so much. Now, let me be clear that if somebody is being abused or coercively controlled, we're having a danger situation, and you know, you don't want to be engaging in conversation about how you're contributing to your abuse. You need to be acting more forcefully. But in the everyday garden variety therapy, my assumption is that ongoing relationship, emotional issues, conflicts and so on, ongoing problems involve both people contributing in a meaningful way. And then there are these kind of special situations, of course, control and domestic violence that this webinar is not about, where you may have to suspend some of that at the moment, but in the ultimate healing that people need to do when they're in a safe situation, they do need to look at the patterns, the broader patterns in the relationship. But anyway, my point here is that when you don't challenge, when you don't have people look at themselves, you're colluding and doing, I think, a couple insensitive therapy. And then the last one is rarely expressing empathy for what the spouse might be experiencing. really focusing on just my client. And there was a famous case and audio I heard some years ago of Albert Ellis, the famous rational emotive counselor, therapist, who was talking to a man who was having extramarital affair, and someone in the audience afterwards said, you never brought up the wife. She didn't come up in the conversation, and Ellis said, famously, she's not my client. So what I'm suggesting is to not express concern, empathy for what the spouse might be experiencing is not couple-sensitive therapy. Okay, so those are signs that it's couple insensitive, and consequences. Undermining potentially viable marriages and committed relationships, failing to help the client learn and develop through relationship difficulties, and distorting the clinical relationship. Those are all bad outcomes. And it's not just hurting the relationship. What I'm suggesting is that it's not good individual therapy because the client is not learning and developing through the challenges. And also to the extent to which I am colluding with the client, it's distorting our relationship. Okay, so what to do? 2 master strategies in CSI therapy. The first is align with the client's therapeutic goals, not with the person against someone. You align with their therapeutic goals, not with the person against someone. And I got that great phrase from my colleague Noelle Larson. So you don't have to make a person an enemy. You can be aligning with the goals for them to be healthy, to be well differentiated, to be, to handle their depression, their anxiety, to be safe, to be, just anything that they are aspiring to. And then sometimes that means, of course, they have to challenge, they have to confront their partner. Sometimes they have to leave their partner. But it's still for the sake of the goal of this client, not against someone. And then the second master strategy is to help the client learn to manage self during relationship difficulties. So this is an opportunity, like any challenge in the client's life. My job is to help them manage themselves during the difficulties. The 2 larger strategies here. Okay, so the craft skills. And I like to use the term craft to think about therapy because we are engaged. Therapy counseling is a conversational craft. I like to use the word craft rather than art because in modern art, contemporary art, every artist is, as Woody Allen once said, their own universe. And they're only responsible really to themselves. A craft is a shared activity. It involves creativity, it involves discipline, it involves learning, and it's shared. The craft of a stonemason, for example. So anyway, that's why I like to use the term craft for therapy. So first one, empathize with the client's pain, not necessarily with their perspective. So some language. What an awfully painful moment for you, as opposed to I can see how hurt you were when your husband put you down in front of his family like that. They're both empathic. So this woman has described this quote, teasing her husband did at Thanksgiving in front of his family with everybody laughing at her, and she felt humiliated. And she's telling me that, and I say, oof, that must have felt terrible, embarrassing. It must have felt like it was painful. It felt like crawling under the table. But I can also say, how terrible he put you down that way. Second, paraphrase the client's perspective neutrally. So you don't think she trusts you and wants to control you. So if somebody's saying she's controlling me, she's just trying to, run my life because she can't run her life and blah, 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 blah. Neutral. So you think she doesn't trust you and is trying to control you. I haven't lined up behind that. I haven't said she wants to control you. I haven't said she doesn't trust you. I've said that's what you're experiencing. Next one, when you are confident the client feels you are connecting with the feelings and experience, and explore the client's own part in the relationship dance. So the craft here is you first connect with the feelings, the experience, the beliefs of the client about this relationship challenge, this incident. So you felt humiliated in front of his family. You felt abandoned, like he wasn't there for you. In fact, not only wasn't there for you, he had sort of gone over to the side of the enemy is what it felt like. Yes, 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 yes. So, yeah, terrible. So tell me what happened leading up to that. Tell me what happened in the conversation before that. And then maybe I find out, and I'm thinking about a particular situation some years ago, where the client, this was the wife, as she talked about what happened at that Thanksgiving meal, she was taking on her father-in-law about some of his traditional sexist attitudes. Okay, so she was using the Thanksgiving meal as a chance to do some combat with her father-in-law, and everyone then got uncomfortable. Husband intervened in a way that took side. But then we talked about her contribution in terms of, in some ways, setting the groundwork for what happened afterwards. It doesn't mean she should never talk to her father-in-law about these things. Doesn't mean what her husband did was right, but she had some place in it. But the timing has to be after you get with their experience. If they draw a blank about their own part, then you can offer your thoughts, and maybe it could be this way. Maybe Charlie, when you give yourself permission to forget things a lot, because you said you do, maybe you are inviting your wife to take over and to treat you like you're the kid who doesn't do his chores. Okay, so that was a challenge on my part. In a maybe it could be this way after I've connected with them. I work with whatever the client initially accepts as his or her part and expanded over time. So I'm thinking about a case where this was a gay male couple where they're in a lot of everyday kind of hassling conflict. The relationship difficulties weren't at the heart of all this for his problems, but it was there, and he was kind of more of a neat Nick, and his partner was not, and so my client would come home and nothing had been picked up, and he was complaining about his partner, and so I said, how do you see your part of it? And he said that maybe he's could be more diplomatic in how he brings things up when he comes home, not just sort of blasting away. So that was a start. Not the most deep start in the world, right? Because he was saying that diplomatic is not, exactly a deep soul-searching term, but it was where we started. Okay, he wasn't diplomatic, so we kind of then that became sort of moved to insensitive, and we kind of went from there. So you start with whatever they give you. Speculate about the spouse's part in the dance, but not their personality. So not this controlling personality, not this this passive dependent personality, but nevertheless what they are doing in this. Okay, how when my client goes one down, it invites the partner to go on a one up, or vice versa. You go up and invites your partner to go one down. But none of that. That's the partner's role in the interaction pattern in the dance. It's not about their core personality. So some more skills. Speculate about the soft feelings under the spouse or partner's hard feelings. So I wonder if your wife's anger that feels so controlling is coming partly from her feeling disconnected from you. So you're probably familiar with the distinction between hard feelings and soft feelings. Hard feelings being anger, frustration, resentment, which in intimate relationships are almost always accompanied by softer feelings, feeling abandoned, feeling like you don't count, feeling alone, feeling rejected. And so you can speculate about the soft feelings under the hard feelings. Don't justify a spouse's unacceptable behavior, but focus on the behavior and the client's responses to it. So it's not right that he curses you. Let's talk about how you can respond next time. Okay, so this, cursing somebody is, in my book, verbally abusive behavior. So you don't just whitewash that in terms of, well, this person must have been having, has his own wounded child. You can label some behavior as unacceptable, and then go to your client, who's the only one you can directly influence, about how they're going to respond, or how they're going to bring it up after this time. But you notice the difference between the behavior and saying you have an abusive husband. That's labeling him as a person and not necessary to accomplish what you want to do. Okay. Lastly, in terms of, or getting towards the last for these craft skills, I think a best practice when you're doing individual therapy with a client who is in a marriage or long-term committed relationship is to invite them to bring their partner in for a session. Why? Well, it gives you perspective on your client. It allows the spouse to see who you are. It affirms the spouse for their willingness. You can affirm them for their willingness to come in. It's important that you treat this spouse as a help for your client's therapy, not like a client. And it's important to not turn the session into problem-solving couples therapy, although something therapeutic might occur. So it's just backing up here. I have a colleague who says she likes to lay eyes on the partner. Okay, this person who's coming up, just getting a sense of who they are, and they can give you a perspective. I remember seeing a guy who had depression and some kind of obsessive thoughts about failing. He was a surgeon, so it's kind of a little risky here, wasn't in for marriage distress or problems, but invited his wife in, and I got a very useful perspective from her about her husband and other scenarios, and particularly about some of his resilience and over the years, and some of the ways in which he really functioned well that hadn't quite come out, as well as her concerns for him, so it was a very nice kind of perspective-giving session. But it's really important that you not turn that in any circumstances into an opportunity for your client to beat up on their partner. That's really unfair. It happens. Unfortunately, it happens. Let's bring in the spouse and tell them how they're making your life hard. And avoid turning it into problem-solving therapy. Although sometimes something therapeutic can happen. I can tell you that in my own family of origin with one of my siblings, who was in individual therapy, and the therapist invited me in when I was traveling back home, and it was powerful. It was wonderful, um, and in fact, although it wasn't intended to give a breakthrough, it was a breakthrough for our relationship, and eventually that reverberated through the family. And so I think it can be very helpful. And two useful questions, and these are again from my colleague Noelle Larson, one of the best therapists I know. What do I need to know about you to be more effective with your spouse or partner? And how do issues in your spouse and I are working on here affect you and your relationship? So two really nice kind of grounding questions for a one-time session. And this, by the way, this can really help you do a couple sensitive therapy, because you now have a richer perspective on your client and their spouse and their relationship. So, so finally, when the client is considering divorce, so sorry about that, here we go. And I want to, people consult with their individual therapists all the time about this, and I want to begin with a quote from the famous founder, one of the founders of family therapy, Carl Whitaker, who said, people marry each other for profoundly important reasons, and no one should divorce until they deal with those things that cause them to marry and then want to divorce each other. People marry each other for profoundly important reasons, and no one should divorce until they deal with those things that cause them to marry and then want to divorce each other. So that's a philosophy I have. There's something to be learned here before people bolt. So what you can do when a client is considering divorce, and here of course I mean whether it's a legal marriage or the breakup of a long-term committed relationship, you can help them reflect on their self, not just on their spouse's inadequacies. That's been a theme of this little webinar. And consider referral for discernment counseling. And this is a new approach to working with couples on the brink that I developed, and we do training on in Minnesota and nationally. And a number of individual therapists are referring folks to us at the University of Minnesota, and we have a directory of people who are trained in discernment counseling. And basically, it's an approach that to what we call mixed agenda couples, where one is leaning out and the other is leaning in to the relationship. If your client is consulting with you about whether they want to stay or go and that they're leaning out, this is an opportunity for them to, for brief 1 to 5 sessions, to come together with their partner for a kind of consultation, the goals of which are for them to have greater clarity and confidence about a direction for the relationship based on a deeper understanding of what's happened to their relationship and each person's contribution. So you can read more about the 1 to 5 session approach. But the elements of that you can do without the referral. So let me be clear, I'm talking about you can refer for an approach that it works with both people together, or you can take some elements of it. So I'm going to give you kind of some core elements of discernment counseling that you can use in your individual practice. And one is that you frame 3 alternative paths. Path 1 is to stay the course without expecting change, so stay married as you've been. Path 2 is separation, divorce. And path 3 is a last major effort with a time frame. Okay, like we do 6 months as a time frame in discernment counseling if they choose couples therapy. So path 3 is a last major effort with a time frame to seek help and to try to make the relationship healthy for both of them. So when you're dealing with a client who is thinking about divorce, a lot of times they think about there's only 2 paths. One is stay in this miserable relationship for the rest of my life, maybe for the sake of the kids, and be unhappy, or get out. And so a heart of this discernment process is there are really 3 paths. One is, well, they could stay and not expect change. They could separate, divorce, or they could carve out a period, an experiment, if you will, a last try with help, with couples therapy, for 6 months is what we talk about, with both people in for the effort, and with divorce off the table, and then evaluate at the end of the 6 months to see if they've put the relationship into a healthy place. And of course, what they have to gain sometimes from that all-out effort is better understanding about self, and maybe a healthier follow-up relationship if this one fails. Now, if you have a client who is once they would like to do this path through, they'd like to try couples therapy, you could coach them on how to deliver a message to their spouse or partner about wanting to stay married but not under the current circumstances, and offering to work on self and the relationship if the spouse will do the same. So I'm talking about somebody who is unhappy, they're demoralized, but you've helped them see that maybe going to couples therapy would could, for a period of time, could help them see if they really could make the marriage work. Excuse me. And then you can help them frame the message to their spouse. And you notice the elements of that are, if it has to be genuine, you know, I love you, I would like this marriage to work, but I can't go on this way. And I know I need to change. I'm hoping you'll work on change in the marriage, that we could work on it together. So that kind of complex message. And when they choose path 2, the divorce path, because their spouse is extremely difficult or dysfunctional, a final question can be something like, how might it be useful for you to realize that you chose someone like this person? Okay, so there's kind of therapeutic gold there, if you will, even when they decide they're going to divorce. Okay, so coming to an end, this discernment counseling that I mentioned, I'll just, if that's intrigued you, if you do couples therapy and you want to learn how to incorporate this 1 to 5 session protocol into your practice, we offer basic training workshops periodically by the Minnesota Couples on the Brink Project. Our next one will be in June, and those are free workshops. And then there's full training available through the Doherty Relationship Institute, which I run with my daughter, Elizabeth Doherty Thomas, and that's online audio module training with opportunity for case consultations. So that's the webinar presentation, and I think we have some time for questions, and I'm eager to engage you in some dialogue here. So, Peter, if you're talking, I can't hear you.
Unmuted.
Okay, can you hear me now?
I can, yes.
Okay, so I've just asked our online audience to type in questions in our question box, and I'm going to hang out here and see what we get. And I know that we've still got a lot of people who are online, so okay, here we go. All right, so if a couple is on the last leg of the relationship, where is the starting point?
I think I need more follow-up on that. If the question is about discernment counseling, which I'm happy to talk a little bit more about, but not fully the topic of the webinar, what we have a structured approach where we have the couple come and we ask a series of questions where we come to understand, and we help try to them understand what's happened to the relationship. So if they're on their last legs now, what we talk about, what's the divorce narrative, what's happened over time that has led them to this place. We ask about what we call the repair narrative, and that is, what have they tried to do to fix the problems? We ask a number of other questions And usually when you say last legs, it's usually somebody is on their last leg, but the other's not. So this is part of the kind of realization that led to some research I've been doing and the development of discernment counseling. People hardly ever come to a mutual agreement that they're going to end their marriage. Somebody is out ahead. There's a leaning out and a leaning in. And so some of the complexity of working with people on this is, if this is your individual client, is this the leaning out person, the leaning in person? And you want to work differently with them depending on which they are. If you're seeing a couple and they're on their, what you say, last legs, there's somebody who's ready to give up all the legs, and the other person is usually saying, no, let's save it. And so it's the challenge of working with people where they're not in accord about whether this relationship is salvageable. So that's for individual counseling. Which are they? Leaning in, leaning out, and if you're seeing there's a couple, who's in what role? So that's a kind of a general answer to the question. And we have a full protocol, that up to 5 sessions for how do you work with people so that they can make a decision with clarity and confidence about how to proceed based on a deeper understanding of what's happened. So thank you for the question.
Okay, so we have another question, and this one reads, how would you direct a couple who is ambivalent about whether or not they want to divorce, and they're feeling very confused about what they really want?
So now you're talking about usually an ambivalent leaning out partner. So I call this divorce ambivalence. And the approach is that you try to help them develop a more complex understanding of what's happened to the marriage and their own contributions as well as their partner's contributions. So very often people, when they are ambivalent about staying or leaving, have a narrative explanation that goes something like this. I'm unhappy and it's my spouse's fault. Or I've done everything I can to make this relationship healthy. I don't know what more I could do, and I don't know how many more chances I'll give my spouse. Or a third common one, narrative, is I not in love anymore. I married the wrong person, the feelings are gone, and I don't know how I'd get them back. Those are 3 really common ones. The other person's making me unhappy. I've done everything humanly possible. And the third one is I'm not in love anymore. Maybe I married the wrong person. And so what you do is help them see their narrative, this narrative, in a more complex way that has them as an actor in this, not just a recipient of what is coming down from a difficult partner. Understanding that of course they may have tried as hard as they possibly could. So you're not suggesting to somebody, no, you haven't tried, but that particularly if they've not had good couples therapy, they've not had outside help. A lot of times what they've been trying is been making it worse. So I've been trying to get through to my partner how he or she needs to take more control of their life. Okay. And in so doing, this person has been going one up, more parental, the other person, inviting the other person to be like a child, and then getting more and more frustrated. So helping them, again, with full support with them and empathy, helping them see their part. And then the third one, with people saying I'm not in love anymore, is to help them. We have a whole little protocol on this, that starting with the idea that love is a decision, not just something that pixie dust gets sprinkled on you. A lot of people think when they're no longer feeling the tremendous passion they felt earlier that means they don't have love anymore. So there's a variety of ways that you can work with people who are experiencing divorce ambivalence to understand themselves, their participation, understand the relationship dance, their partner's contribution in a more complex way, which sometimes is quite clarifying that they're done, and other times is quite clarifying that they want to give this another shot with good help. So thanks for the question.
Okay, we have one more here. So this came from the person, who had the first question, and the follow-up to that is, how do you get the person who's leaning out to buy into therapy?
Yeah, so it's really doing what I was talking about in response to the second question. So let me rephrase this. So it's not that I want to get them to buy. I want to offer this option. I want to kind of present it to them in a way that gives them a chance to make an informed decision. Not trying to sell it to them, but if there's one sort of key thing, I won't repeat everything I just said a minute ago about the three narratives and the explanations, but a key thing that is good for the individual therapy, regardless of whether the person chooses to work on the marriage, is to really push on their contributions to the problems. We're so much better at understanding our partner's contributions, and so really hanging in there with that, because there is therapeutic gold here. One of the things I say to people sometimes is, you can't divorce yourself, and we carry ourselves into our next relationships. So if somebody is interested in a future relationship, they can benefit from understanding what they contributed to this one, beyond just the simplistic idea that I stayed too long, and I'm willing. And by the way, in Discernment Counseling, we spend a lot of time on this with each person, individually, and I'm willing to be pretty challenging when somebody won't engage with their own contributions. What they'll say is, well, I'm not perfect, and then they'll blah 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 with their partner, and I'll just with firmness but compassion hang in there and say, I'm thinking about a particular client where I said, every time we start down the road of talking about your part in this, you turn it to your husband really quickly. I don't know if you've noticed that. Well, yeah, I guess I do that. And then she did it again. And so I said, so there you go. So what would it be like if we spent 10 minutes in which during that 10 minutes we talk nothing about your spouse's contributions, but just about yours. And then when she still struggled, and I said, so you may decide on this path to go through with divorce, and I get that you've been through a lot in this relationship. I get that you don't trust that he's going to change. I just want to express a worry for you that you're maybe not using this opportunity now to really do some soul searching and to see what you can learn for yourself. And I'm worried that if you don't do that, you could find yourself with a different partner, but with a similar predicament in the future. Then she opened up. But it really took some work. And so last thing I'll say is that sometimes people will say, well, okay, I do see my issues, and they have explored those. And then what they say is, my partner cannot change. Why would I try to do couples therapy if my spouse can't change? Now, there are some situations where the track record, where this person has been multiple affairs, each time begging for forgiveness and not showing a lot of insight, okay, and it's just sort of saying, well, take me back. Well, I really get that. But in other situations, what I found is that the leaning in spouse who's gotten a wake-up call that and saying, I really want to change, I really want to fix this, I'm in to try. And then the leaning out client is sort of from up on high pronouncing the incapacity of their spouse to ever change. And I will challenge that. Who knows that? I mean, who can say that their spouse can't change? Now, you can say with clarity, I want to try. I don't want to take the risk that my spouse can't change. Okay, but not, it's sort of playing God to make a factual pronouncement that your spouse cannot change. And so I'll challenge that. And in fact, what I often say is, I wonder if the issue is whether you think you can change. So those are some examples of some challenges that I will put to somebody who is leaning out and I think maybe copping out a bit from looking at themselves.